Lisa.
Hi.
Did you get a chance to read the procedure for the manual read Roche Chem Strip?
I did.
Great. Did you take your workday learning quiz?
Yes.
And passed it with 100%?
I want to be sure.
Okay, great. So we're going to talk about the test and the procedure itself.
Okay.
And then I'm going to show you how to run a test and read the strips.
Okay.
And then you're going to fill out this quality control document.
Okay.
And you'll run both the normal and the abnormal, which is level 1 and level 2 for our purposes.
Okay.
When we look at the chem strips themselves, so they come in a bottle, and the bottle should always be capped. You know, in order to get into it, you have to pop the cap.
Right.
But if you're not using them, they need to be sealed. And they need to be kept in room temperature, away from light and moisture. So on these test strips are little reagent pads. And on those reagent pads, when urine or quality control is put on them, they change colors. And the color changes mean different test results. So when we look at the results, we're going to hold the strip like this with the handle at the top, and we're going to match the colors to the squares, and that will be our individual test results. Okay. What we'll need for running a specimen is a random clean catch urine. The optimal volume is 15 mLs or greater. The minimum volume is 1 ml. So you'll just have your cup of urine. You will dip the strip into the urine. Sometimes you have to tip the cup a little bit to the side, but just make sure all of the pads are have been impregnated with urine on them. So then you'll pull your, meaning urine got on all the pads. So you're going to pull your strip out of the urine cup. You can put it on its side and let it dry. Or if this were the urine cup, you would pull it out of the urine and pull it across the lid. That will take some of the urine off the strips, but also you can blot it and set it down for the minute.
Okay.
Okay. So, we'll need a timer. We have our timer, patient specimen, or both levels of quality control. That's what you're going to be working with today. Storage and handling. We already talked that storage is at room temperature, and that these are good until the expiration date written on the bottle, provided that this cap stays on. And then also, when you pull strips out, you want to make sure that they don't look like they've deteriorated in any way. These have color pads on them, and if they are brownish or darkened in color already before you even run a test on it, just get a new bottle.
Okay.
Alright. So the procedure is that you ensure the specimens are at room temperature. You check the dipstick bottle date for open and expiration date. So there's your open date and there's your expiration date. Briefly dip the test strip in urine, being sure that all the test areas are immersed, and then begin your timing at that point. Timing is for 1 minute. You can also see that the timing is for 1 minute right there. That tells you. After the 1 minute, you're going to compare the test strip areas with the color chart printed on the bottle. I showed you how you hold your strip up and you compare it to the different squares. And then we'll document the results on our sheet of paper for all of our documents. Normal values are written right here, so let's take a look at those. Normal urine values for specific gravity are from 1.005 to 1.030. pH is 5.0 to 6.0, and you can look that all of this is normally negative. All of the rest of these results are normally negative. Urobilinogen can be up to 1 milligrams per deciliter. Something to keep in mind about quality control. Quality control is performed on each bottle before any patient testing, and repeated if questioning an unexpected or an abnormal patient result. Document QC on the QC log if a result is not within range and what corrective action was taken. So if you have your ranges that we're going to write in here and one of these results did not fall in the range, we'll need to document here what we did to correct that action. So 9 times out of 10?
Physician.
Well, 9 times out of 10, if this normal QC result didn't fall within what our normal results for QC should be, we just repeat it.
Oh,
okay, that's what it was talking about. Okay, great. So can I have some gloves real quick, and
Yeah.
I'll show you how we wet the strips, and then how we will read them.
Mm-hmm.
Okay. So if I have my patient here,
Mm-hmm.
and I had a cup and I uncapped the cup, I would dip the pads all the way down into the urine, and then as I pull it away from the cup, I drag it across the side, and then I would set my timer for 1 minute. So after my 1 minute is over and my timer starts beeping, I will hold the strip up and compare. So if I'm looking at my pH, it matches that value right there.
Mhm.
So I'll take my pen,
Mm-hmm.
and my pH is 1.020. And then I look at my specific gravity, or that my specific gravity is 1.020. My pH matches 6. Leukocytes, negative. And then we just go on throughout the whole strip, matching what the result is and writing it down.
Mm-hmm.
When we're done with this result, we want to document on the patient log that we did a test on this urine strip lot number,
Mm-hmm.
the date it was put into use, and its expiration date is written at the top. And so what this says is that on this day, we ran a urine test on this bottle of test strips.
Okay.
Good?
Mm-hmm.
Let's go ahead and talk about QC. QC, or quality control. I brought you a sheet that you can fill out,
Okay.
and what we're going to do is unit, which is our location, and your name, your employee number, and the date. So when it talks about Roche ChemStrip lot number, it's talking about the lot number on that bottle. Lot number. Very good. And the expiration date is what's on the bottle itself. It does not change when you open it.
Okay.
So we're going to talk about normal lot number, abnormal lot number, and expiration date. Today we're using MAS QC. So our normal is our 1, our abnormal is 2. You're going to write your normal lot number and your expiration date, and your normal lot number and expiration date in the spaces provided. So, in our boxes of MAS quality control, we want to know what normal ranges we write here and what abnormal ranges we write here. And the ranges mean that when you dip your normal control, the number you get here should fall within the number range here for normal. And the same for abnormal. The number you get for abnormal should fall within the range for abnormal. In the box of the MAS QC is this package insert, and you can see this website here will give you your quality control ranges. So when you type in this www.mosslablink.com and you have the /PI/ this number.pdf is for this lot number of QC.
Okay.
When you go to that website, you will scroll down until you see Roche ChemStrip Visual. You can see that they give you lots of other options, but these are the ranges that you need for what we're doing today. Roche ChemStrip, normal and abnormal visual read.
Gotcha.
Okay, so when you look at Roche ChemStrip Visual, you can see that these are the ranges you're supposed to write for your normal level, level 1, and these are the ranges you're supposed to write for your abnormal level, or level 2. So let's go ahead and document that now. Make sure when you're writing your ranges down that you make sure that if it's a test like protein, you're using your milligrams per deciliter as units.
Okay.
Go ahead and do that now.